Thank you. It's great to be with you today. My name is Kelly White. I'm the CEO and co-founder of Risk Recon, a leading provider of cybersecurity ratings and insights that's widely used in the healthcare industry to manage third-party and larger supply chain cybersecurity risks. Today, we're going to be talking about a very important topic, protecting the enterprise in the age of supply chain attacks. And I've brought with me my friends who are practitioners in the front line, protecting organizations and their supply chains. So really glad to have Keith, Dan, and Jim with us today. We're actually going to break this presentation out into 4 segments. First, I'll be sharing some research that Risk Recon's done on concentration risk in the US healthcare industry. Pretty important if you're going to think about managing supply chain risk. And then we have the privilege of talking with Keith Lichtenwallner of Pfizer, who's responsible for managing cybersecurity in their drug manufacturing supply chain. He's had a big job over the last 12 months, scaling for the vaccine production that they've brought to the world. Following that, I'll be joined by Chief Information Security Officers, Jim Routh, and also Dan Bowden of Centera Healthcare. Well, they'll give us some CISO to CISO advice on our topic, protecting the enterprise in the age of supply chain attacks. We'll close with the best part, which is your questions. So with that, let's get going. Oh, it's been a busy 6 months for us in security and in the supply chain. What is it about, let's pause for a minute and orient. What is it about these 2 companies that make them really compelling targets for criminals to compromise? Well, just look at the hero statement there on the left that appears on the SolarWinds Orion product page. One platform to rule your IT stack. That's a pretty compelling and powerful statement. Great, your admins can more easily manage that growing complex infrastructure. Put on your hacker hat, the criminals look at this and say, if I can get malicious backdoor code into that software, it's going to get distributed to all of these environments. And the hero statement for me is going to be one platform for me to rule your IT stack. And that's really exactly what happened. Now, the dynamics of CodeCov are different, but they represent the same temptation for criminals. Compromise many organizations by compromising one. And once you've got access to that code, you don't have to do many modifications to steal data. This is what happened to CodeCov. A single line change to an existing line of code. So let's get started in talking about concentration risk in the US healthcare industry. This is based on Risk Recon's analysis of 7,400 healthcare enterprises. Now, those enterprises we scoped to healthcare providers, enterprise healthcare providers, and also healthcare insurance companies. We're seeking to understand what's the hosting provider concentration risk and also the software concentration risk in this supply chain, both from the third-party dimension and also fourth party, another layer into the supply chain. Let's start with that third-party layer, looking at hosting providers and software used directly by US healthcare companies. So the first thing we see is that there are 649 hosting providers that host systems for 10 or more healthcare companies in the United States. Quite a large number. Now, there's no surprise probably to many of you that Amazon and Microsoft take the top spots at 41% and 34% respectively. You go down the line and you only have to go down 6 providers, ending at Network Solutions, and below that, you're in single-digit concentration risk. So Cloudflare, for example, provides hosting for 19% of US healthcare organizations. You go down the line and you see that Rackspace and Linode are hosting less than 4%. But this is This is probably the top 15 of the 649. Yes, there's 649 hosting providers hosting one or more systems for US healthcare companies. But the vast majority of the concentration risk resides within the top 20. Now, when we look at the dimension of enterprise software used by healthcare companies, we see that there's, from what Risk Recon can identify through its passive analytics on that supply, on the industry, we identify 6,388 unique enterprise software families that are used. jQuery is used by everybody, 99% from our assessments. There's a huge number, 64% that are using WordPress, another 62% using Apache and ASP.NET technology, and on down the line. A little further down, you see Microsoft Exchange used by 43% of US healthcare organizations. So a much broader arena of software, enterprise software, in comparison to hosting providers, that makes sense. Also, a larger number of companies than we see with healthcare, with hosting providers that are where we see significant concentration risk. Again, looking at a tree map, it looks like this. jQuery up in the upper left, and then below that, WordPress and so forth. But look at that vast supply chain. A lot of the software, as you get down to that lower right, is just used by a very small number of organizations. But again, a common theme here. In hosting providers, we saw that there were 20 hosting providers that are really providing the material and majority of hosting services for healthcare industry. Here you need to get out to about 50 or 60 enterprise software product families to capture the majority of the concentration risk. But again, that's 1% of the total enterprise software product families that we observe. So now let's branch out into another layer and take a look at the fourth parties. These are the vendors to healthcare companies, claims processors and different organizations like that that you're relying on. What do we see there? On the left, we have the hosting providers used directly by healthcare companies. And on the right, we have the hosting providers used by vendors to healthcare companies. Vendors to healthcare companies, we identify 450 different hosting providers, hosting systems for 10 or more companies that are vendors to healthcare companies. In comparison to the 649 we found providing services directly to healthcare companies. So there's more concentration in the vendor side. What else do we see? Well, materially, with one exception, this top 14 or 15 companies, it's the same companies. AWS, Microsoft, GoDaddy, Network Solutions, Akamai, Liquid Web, and so forth. Now the concentration is different, but the list really remains the same. So for example, 58% of vendors to healthcare companies are using Amazon Web Services in comparison to AWS, 41%. HubSpot, 20% of vendors to healthcare companies are using HubSpot in comparison to 6%. Now, when we look at this from the angle of enterprise software product use, again, comparing healthcare companies, what software they're using relative to vendors to healthcare companies, we see that vendors to healthcare companies have a much wider identifiable enterprise software stack, well over 8,000, compared to healthcare companies, 6,000. jQuery still takes the top spot. WordPress, 72% of vendors to healthcare companies are using those in comparison to 65%. Exchange is still prominently used. In fact, vendors to healthcare companies, 52% of them are using Exchange compared to healthcare company use at 42%. Also notice, though, that the list of software on here is the same. Again, the ranking and their use, a little different. But when you branch out to the 30 to 40%, the 30 to 40 companies, highest to lowest concentration risk, the lists are the same. So the healthcare industry itself is materially facing a digital supply chain challenge that looks the same as an industry as it does for their vendors. Okay, so what? Now, some of this might be obvious, but I think it's good to see this in its explicit detail. And we're going to be publishing with HISAC a paper that we'll be releasing to membership that provides a more broad enumeration of these in a white paper. But so what? Well, a couple things. One, the digital supply chain is very complex. Just from what Risk Recon can identify, hosting providers, upwards of 650 different hosting providers for the healthcare industry, 450 for the vendors to the healthcare industry directly. There's high concentration in about 20, whether you're looking at the third or fourth party hosting providers, there's very high concentration among 20 hosting providers. A problem with one of those, availability or a breach, can have significant impact to the US healthcare industry. What did we see in the software? A massive number of enterprise software product families, upwards of over 8,000 that we can identify from Risk Recon's vantage point of outside intelligence. But again, about 1% of companies of software product families represent the vast majority of the concentration risk. So yes, it's a very complex digital supply chain, but risk is highly concentrated in a small percentage of those. And it's important to be aware of those. Why? Well, a couple of thoughts there. When you look at that landscape, you may not use WordPress in your environment, or you may not host systems with DigitalOcean. But as a CISO, it's important to understand that given the realities of this concentration risk, yes, your organization may not be using that software, but you can be certain that a large portion of your supply chain is using that software or that hosting provider. And so security events and outages that happen to those companies where we have concentration risk are very likely going to have an impact to you because of the supply chain and that digital supply chain relationships. Now, this problem is bigger, I think, this digital supply chain and just this general supply chain problem perhaps is bigger and more complex than we have solutions for today. That's what you and others are busy working on, and that's what we're going to be talking about with Dan and Jim and Keith. But here's a few ideas that I'll plant for you in your minds. As an industry, perhaps led by HISAC, perhaps with this understanding of the concentration risk and the critical dependency that the healthcare industry has on this small subset of software and hosting providers, maybe it's time to come together as an industry, specifically sharing this kind of concentration risk information and seek more transparency from these critical providers. And perhaps there's a shared industry service that, hey, pay attention. Let's pay attention to the events that are happening at these organizations. Just making these vendors and providers aware of their important role in the healthcare supply chain would go a long ways towards progress. Now, what about within your own enterprise as a CISO or a director of cybersecurity risk in your supply chain? Yep, as we said, many of these companies may not be direct suppliers to you, but no doubt they're important to your vendors. So I'd suggest it would be a good idea to open your risk aperture a bit wider and include these companies, these important software providers, these important hosting providers where there's concentration risk, and maintain situational awareness of what's going on there as a starting point. And with that understanding, that's where supply chain risk management begins. After all, that is what we're talking about here, is having, if we're going to manage supply chain risk, we need to understand what our dependencies are and also start maintaining situational risk awareness. That's a starting point. And there's other ideas that can build upon that as you collaborate as an industry and also just within your own organization.